Hey everybody, welcome to Pick Dr. Osborne's Brain. Happy New Year. It's going to be a great show tonight. We're going to be covering the topic of nerve pain and neuropathy. Many people struggle with this problem on a regular basis. It's no laughing matter. And we're going to be taking a deep dive crash course into nerve pain and neuropathy tonight. So before we get started, you know the drill. Tune in, say hello, give me a thumbs up, give me a heart button. Let me know that you're listening. Let me know that I'm coming in loud and clear to you. And tell me where you're from. We like to know here where we're reaching people, how far our reach is. Remember our goal, saving 100 million lives. So help me help you. Share this information with somebody you know who might take benefit from it. So let's dive in. Neuropathy, what does that really mean? It's just a fancy medical term that means nerve disease or nerve damage. And so there are different types of neuropathy, generally speaking. You've got neuropathies that can be centralized, meaning coming from your brain or spinal cord, and then you have what are called peripheral neuropathies. These are when the symptoms manifest outside of the brain or spinal cord, so more in your hands, for example, or in your feet or in your legs, numbness, tingling, burning pain, those types of symptoms that occur in the periphery. So we've got nerve damage that can happen in the brain or spinal cord. We've got nerve damage that can happen in the peripheral nerves. So those are your, again, basic breakdown of the two different classic types of neuropathy. Now, causes for neuropathy are multifactorial. There are a number of different reasons why we might see somebody developing a neuropathy or a nerve damage type of problem. Now, some of those causes can be physical in nature. So if you've ever heard of, for example, a herniated disc, lumbar disc, cervical disc, spine or neck, a herniated disc can put pressure on a nerve, causing a lot of compression that leads to nerve damage, numbness, tingling, loss of motor control, or loss of muscle or weakness. So this is a physical neuropathy, meaning there's a physical damage that is occupying space that's putting pressure, compressing the nerve, and that can happen as a result of a disc. Then you can also have neuropathies as a result of other forms of trauma. Sometimes people get into car accidents and they damage the scalene muscles, the muscles in the neck or the tissues deep in the neck, or they'll stretch the plexus of nerves in the neck and shoulder called the brachial plexus. And those types of traumatic damages can also cause a neuropathy. Now, the good news here, if you've ever been in a car accident, if you've ever had a herniated disc, these are both pretty treatable and I won't say easy to overcome, but can be relatively easy to overcome if the right treatments are appropriated. So those are physical neuropathies, not the same thing as the bulk of what we're going to be getting into tonight. Now, another thing that can cause a physical neuropathy, since we're on the topic, is a tumor or what's called a space-occupying lesion, SOL, space-occupying lesion. So a mass that's putting pressure again into those nerves as they're trying to exit the spinal cord and distribute out into the hands or feet. So again, those are your physical, and again, this is not intended to be a fully comprehensive medical class in neuropathy, but these are some of your basic ones that are quite common. Then you have what we refer to as chemical neuropathies. And so what does that really mean? A chemical neuropathy can be caused, there are different kinds. There's nutritional chemical neuropathies. And this is going to be our focus tonight, is nutritional. But then there's also true chemical neuropathies or environmental exposures that you might come across. And some environmental exposures can actually create nerve damage. So like an example of an environmental exposure neuropathy would be from pesticides. Organophosphates as a class of pesticides are notorious and very well documented in medical literature to create nerve damage and nerve problems. And so if you're, for example, a farmer and you're around a lot of pesticides, if you're a bug guy, a bug sprayer, and you're around a lot of pesticides, things of that nature, you know, and you're struggling with neurological symptoms and you've been to the doctor and you know, nobody's been able to help you, you don't have any physical problems, they've done an MRI, there's no disc herniation, there's no trauma, but you just have this chemical neuropathy that set in slowly over time, this is where you can ask your doctor to start testing you for environmental exposures to chemicals. And pesticide is just one type. Certainly there are other chemicals that can create neuropathy beyond pesticides, and some of those I really wouldn't even classify them as chemicals, so to speak. I'd more classify them as, as toxins. But metals, heavy metals, particularly, there are some that can create or contribute to neuropathy. So many of you have probably heard of mercury toxicity. There's a lot of debate right now going on about in the vaccine world about whether or not mercury being used as an adjuvant in vaccines is safe, is actually a safe adjuvant. And there's a lot of research on mercury-induced neurotoxicity, meaning mercury is a known neurotoxin. We know it can create damage. We also know from research on dental amalgam. So if you had your fillings done longer ago than 20 years, the likelihood that you have silver amalgams in your mouth that contain a form of mercury is very, very high. And so that mercury, from a toxic metal perspective, can definitely create a neuropathy type of problem. So, aside from vaccines and aside from amalgams, some people are eating high quantities of fish and getting mercury exposure from bigger, larger fish because of contamination in some of the waters. So mercury is a form of heavy metal or toxic metal. Lead, arsenic is a form, and then thallium. These are some of the main metals really that we can see create a neurological type of damage that, again, neuropathy, numbness, tingling, burning pain, changes in motor strength, so losing strength in your hands or losing strength in your arms or legs, weakness. Those are signs of the potential for neuropathy. So if you have a work history where you've been around lead or arsenic or thallium, and those of you who've been around lead, generally if you grew up in your 40s or older, you grew up at a time where lead was in the gasoline, lead was in paint, lead was in children's toys, before it actually became illegal for this to be the case. So you might have had your fair share of exposure to lead. Those that get exposure to arsenic, generally speaking, arsenic is generally got to be working with this stuff. I've not yet seen somebody with massive arsenic exposure, at least clinically. Thallium I see on a regular basis because of air and water contamination. Thallium is a common contaminant that we do see. So these things, again, if you have a mysterious neuropathy, if you have a mysterious nerve pain and your doctor's saying we don't really know why, and they're trying to give you pain management. And one of the reasons why I used to run a pain management clinic, like I was in charge of a clinic for a number of years, and pain management's a bad deal in my opinion. So if we're talking about pain management, what does that really mean? Pain management means let's agree to give up. We don't know why you have the pain, but because we care about you, we're going to give you medicine that mitigates the intensity of your pain. And so that's when I say give up, I mean literally, we don't know why it's there, so let's medicate it. Or in some cases, the damage, there are some cases physically where the damage is so severe, the trauma was so severe that, pain management is a good idea. But if you have a mysterious unknown neuropathy, pain management's a bad idea, because what does that look like? Pain management for most people looks like antidepressants like SSRIs, drugs that affect serotonin or dopamine. It looks like drugs that can affect nerve axon potential like GABA, or rather gabapentin. And, so an example of that would be like Lyrica, if you have ever been in the pain management world. As a matter of fact, raise your hand if you've been in the pain management world, if you have experienced neuropathy to such a severe degree that your doctor put you on medications. Just raise your hand or type in #neuropathy. So gabapentin or Lyrica, and then pain meds, right? So this could be anything from the gambit of opiates, like some of the really, really powerful prescriptive pain medications that are highly addictive and basically don't come without side effects. They come with the side effects of aside from addiction, of risk of death, a very real risk of death when you take them. But additionally, they shut down the gut, and among other things, they shut down the gut, cause severe enough constipation to cause digestive issues that lead to malabsorption and malnutrition. And you'll understand why that's so important here in just a minute. But pain management through opiates, through drugs like steroids, which is common in people I see that have had a herniated disc based, they get a steroid injection in the disc to try to help reduce the swelling. So steroids, and then also non-steroidal anti-inflammatories. Now, when we look at these two medicines alone, the pain opiates and the non-steroidal anti-inflammatories, these two medicines kind of combined together account for about 37,000 deaths a year. And this is just purposeful use. This is not, hey, you had an accidental overdose. This is, you took the right amount, you took it as prescribed, but the risk of dying is great. And so some people just die. As a matter of fact, I think it was Thomas Frieden, one of the ex-directors of the CDC. I'm paraphrasing a quote from him, but I think he said something along the lines of, we know of no other medication that is so frequently prescribed that causes death so frequently than opiates. So kind of a dangerous deal here. So I don't really, unless there's absolutely zero other options where you've ruled all the things that we're going to talk about tonight out, this is not an avenue that I recommend, because it doesn't tend to end. It just tends to change. In other words, you go back and back and back to the pain management docs, and they just keep pumping you full of different combinations and cocktails of different medications, trying to mitigate or manage your pain without, again, fundamentally asking why the pain is there. And neuropathy pain or neuropathic pain can be severe. Some of the worst cases of neuropathic pain that I've seen have to do with a condition called reflex sympathetic dystrophy, so RSD, if you've ever heard of that. Some people call it complex regional pain syndrome, but we'll just call it RSD. This is one that generally can be unrelenting. The pain can be unrelenting to the point where it gets so severe that the person might even want to take their own life. So this is, neurological pain is a real bear. It's really, really a struggle for a lot of people to deal with. Now I want to share with you kind of the big topic of tonight, which is this. So we talked a little bit about some environmental exposures that can create neuropathy. And although these are common, these are anywhere near as common as the nutritional causes of neuropathy. So I'm going to dive in to those in a little bit more detail tonight, because I think it's important that you understand these in much better detail if you're going to get a good handle, especially if you struggle with this or know a family member that's struggling with this. How do you get a good handle on it? Okay, so the nutritional neuropathies, and I'll go ahead and pop up a slide here for you to check out on nutritional neuropathies. Now, the slide you're looking at is not comprehensive. It does not contain all the ones I'm going to talk about tonight. So if you have your notepad handy, you're going to want to take some notes, because we're going to dive pretty deep into this. But there are a number of nutritional neuropathies. And so I'll start off with one of the most common. So I'm going to put a star by it, because by far it is clinically one of the most common forms of neuropathy that we see, vitamin B12 deficiency. Now, all these are deficiency neuropathies unless I specify otherwise, meaning that it's you not having enough of the nutrient, not a toxicity of the nutrient. So there are examples that I'll give tonight where a nutrient toxicity could lead to neuropathy, but these are deficiency unless I state otherwise. So vitamin B12 deficiency can cause a degradation of the brain. It can cause a degradation of the spinal cord, and it generally manifests, it can manifest as a form of MS, multiple sclerosis. So if you've heard of multiple sclerosis, which is a demyelinating disease of the central nervous system, B12 deficiency can cause that. And one of the reasons why is that B12 is necessary for myelin. The myelin sheath, which is the coating or the insulation that surrounds your nerves, that myelin is an insulator. And so if the insulation is gone, then the nerve, when it's trying to transmit its electrical impulse or energy, the energy or the impulse doesn't make it, doesn't get quite as far as it should. And so we get shorts, kind of quote unquote shorts in the wire, so to speak. And so B12 deficiency will cause that. Now, this typically manifests early onset. So if we're talking about really early on, as numbness and tingling. So before MS is developed, most people don't wake up one day and have all the symptoms of multiple sclerosis. They generally will manifest first with numbness and tingling. And this typically occurs in the feet. Numbness and tingling in the feet, toes, can sometimes also be the fingers. So think toes and fingers. These are common neuropathies that can be B12 induced. So again, if you've been to the neurologist and you've had, the brachial plexus and the disc ruled out, and you've had different kind of nerve impingement or entrapment syndromes ruled out, like carpal tunnel syndrome or median nerve syndrome or cubital tunnel syndrome, some of these other kind of common neurological impingement syndromes, if those have been ruled out, you need to start asking your doctor about B12. Now, one of the biggest problems I see with B12 neuropathy is when you go to the doctor, they generally will test your serum. And serum is a bad idea because you can get a lot of false negative with serum B12 testing, meaning serum B12 levels might look normal, but you're actually still vitamin B12 deficient. And so better markers for B12 deficiency would be something called MMA, methylmalonic acid. And you can also have another chemical tested called homocysteine, which is an indirect marker that can indicate that you have a B12 deficiency. But number one, the best way to look for it is lymphocyte proliferation. This is a specialized type of white blood cell test that can help you understand whether or not you have B12 deficiency inside the cells themselves. So B12 deficiency, numbness and tingling, the feet, toes, fingers, hands. Generally, the numbness and tingling doesn't radiate. So it's important, if you're trying to think about whether or not you should suspect this, it generally doesn't start from the top and radiate down. It generally starts here, or it starts in the feet. It doesn't radiate down the legs. So again, a lot of your neuropathies that are what we talked about earlier, space-occupying lesion, or something is pressing on the nerve, those types of neuropathies tend to radiate. So they tend to start up higher and then radiate down the arms or legs, whereas this is one of those that generally starts in the feet or starts lower in the hands themselves. So B12 deficiency, very, very common. Now, B vitamins in general there are a lot of B vitamins that can cause neuropathy. We'll go down the list here. Vitamin B1, vitamin B2, vitamin B3, vitamin B6. I skipped one, vitamin B5, and folate. We'll just add folate in up here. These can all cause neuropathy. So every single one of these deficiencies of B vitamins can cause neuropathy for different reasons. Now, some of them are more well understood than others, at least from a physiology standpoint. Folate deficiency can mimic all the things that happen with a B12 deficiency. So these two have a lot of similar functions and play together, so to speak. So folate deficiency can cause the same type of numbness, tingling in the feet or hands or fingers. And so this is a very, very common deficiency. As a matter of fact, it's such a common deficiency. This is why when you look at food today, processed food is fortified with folic acid. Now, I don't agree with that. I don't agree that folic acid is a synthetic derivative of folate, which is, there are some research studies showing that folic acid itself is a carcinogen, can contribute to cancer. So I don't really recommend eating processed foods that are fortified with folic acid. But my point is, it's such a common deficiency that the government stepped in and started fortifying foods to prevent neurological types of problems, especially in pregnant women giving birth to new babies. Neural tube defects is an example of a nerve, of a poor development of the nervous system that can lead to a number of problems like cleft palate, etc. So folate, very commonly a cause of neuropathy. Vitamin B1 deficiency, also known as beriberi, causes what's called a wet neuropathy. And so this type of neuropathy is generally because beriberi affects the production of something called acetylcholine. Acetylcholine is a neurotransmitter, and you need acetylcholine. So that your nervous system can communicate to your muscles, and your nervous system can communicate to your organs and your other tissues. And so a long-term deficiency of vitamin B1 can lead to acetylcholine depletion, meaning you don't make the neurotransmitter necessary for most of your nerves to communicate, and so neuropathy can begin to develop. You've also got vitamin B2 deficiency, and this can cause demyelinization as well. So demyelinization of the nervous system, just like vitamin B12. So B2 and B12, but there's also another type of suspicion behind vitamin B2, in that you need vitamin B2 to produce glutathione. And glutathione is one of the most powerful antioxidants in the body. And as an antioxidant, it helps to protect and preserve nerve tissue. So two different ways potentially that vitamin B2 deficiency could cause it. Now, B3 generally doesn't cause this type of neuropathy. B3 deficiency, we'll call it more of a central problem, because it leads to think of it as cognitive decline, right? So cognitive function versus numbness, tingling, and that kind of thing. You might get memory problems or word recall issues. Dementia is a late stage pellagra, which is what vitamin B3 deficiency is. It's called pellagra. That's the name of the disease, but it causes cognitive decline. And that's a form of neuropathy too. So sometimes when we're talking about neuropathy, we're talking about pain and numbness and tingling and that kind of neuropathy, but this is also a form of centralized. Remember I said central and peripheral neuropathy. This is a form of central neuropathy. Then you've got B6. Now B6 is unique because B6 deficiency can cause neuropathy, but so can a B6 toxicity. So some of you may have taken B vitamins, and if you've ever taken too much B6 and ever experienced numbness and tingling begin, agitation can happen as well. So mood swings, agitation, numbness and tingling in the hands and feet, very common as a toxicity. Too much B6, it's actually really the only B vitamin that has any known toxicity symptoms is vitamin B6. So if you're taking high doses of vitamin B6, generally upwards of 200 milligrams a day for long periods of time, then you can run the risk of developing a vitamin B6 neuropathy from a toxicity perspective. So again, this one can create neuropathy both ways, whether you're deficient in it or whether you're toxic in it. And then vitamin B5. Now this one's really unique in the way that it presents. This is oftentimes referred to as the burning foot neuropathy. So if you get burning in your feet, that's kind of a hallmark or classic of vitamin B5 deficiency. So that burning foot or burning feet neuropathy or nerve pain is very, very common in vitamin B5 deficiency. So again, your B vitamins as a family are very, very important for neurological function. And so a deficiency in literally any one of them can contribute to neurological types of symptoms. So you've got to be careful. Again, if you're struggling with a mysterious neuropathy and don't know why, we go back to testing, right? Just like I said here, this is for B12 up here, but we could just put a little star by lymphocyte proliferation, because this can be used to measure all of these. The only thing that you can't do with lymphocyte proliferation is measure for a vitamin B6 toxicity. And for that, you'd run, in this case, this is where you would run a serum B6 level to see if the level's too high. And generally, the only time we're going to get a B6 toxicity issue is if somebody naturally eats foods high in B6. It's because somebody is supplementing with pharmaceutical doses of B6 over a longer period of time, and that's what's creating it. So again, this is only going to occur if you're supplementing. So testing serum to see if the supplement's pushing it way too high is something that can be measured to help you rule in or out a toxicity of vitamin B6. So again, let's take the scenario here. Maybe you've been supplementing with high doses of B vitamins for a really long time, and you started to develop a neuropathy, and you look at your formulation and it's got high levels of vitamin B6 in it. This is where you might suspect that B6 toxicity versus, say, a deficiency of some of these other things. So those are your classic neuropathy B vitamin deficiencies that you can manifest. Now, there's other vitamins, there's other minerals that can also contribute to neuropathy. And so I think we'd be remiss to not mention some of these. One of them is vitamin E. Now, vitamin E has been really well researched as a cause of neuropathy. So vitamin E deficiency can lead to, and this has to do for vitamin E is a strong, potent antioxidant. And so some nerve damage is caused as a result of pro-oxidation. So damage and inflammation that causes oxidation. So you need antioxidants. So if your vitamin E is low and you're getting exposure to oxidation or a lot of oxidants, you can start to develop a vitamin E neuropathy as a result of that. So vitamin E, very, very important. Again, one of those that can be tested for, can be checked. Additionally, this is another really quite common one is copper deficiency. So copper, just like vitamin B2 and vitamin B12, copper helps produce the myelin sheath. Now, there's two roles that copper plays. One is in its production of the coating around your nerves. The other is as an antioxidant. Copper runs a system in your body called superoxide dismutase, or SOD. SOD is an antioxidant system. It's a very potent antioxidant system. Again, it preserves the integrity of your nerve tissue. So between the production of myelin and as an antioxidant, copper deficiency can contribute to neurological symptoms as well. So again, these are some of your common ones. Now, I want to add one more to the list because I see it frequently enough, and we'll talk about why in just a minute. And that's, I'm going to add it up here, Coenzyme Q10, CoQ10. Now, The reason why we put CoQ10 in here is we know that CoQ10 deficiency can cause nerve damage. We are absolutely certain of that. There are polyneuropathies associated with a number of research studies. I've seen it clinically a number of times. But it's the reason I mention it tonight and want to bring it up is that although this is not a super common deficiency, unless you're taking medicines. Now, I'm going to pop up another image for you on some of the medicines that can cause neuropathy. And most of these medicines cause neuropathy directly as a result of either inhibiting something on this list or of being neurotoxic themselves. So the medicine either damages the nerves directly or the medicine causes nutritional deficiency in one of these items. And CoQ10 is a big one. And why I put it up here, because how many of you are taking a statin to lower your cholesterol? How many of you are taking diabetes medications like metformin? These two classes of statins, number one medication prescribed. They cause CoQ10 deficiency, and CoQ10 deficiency can cause a neuropathy. And then you got diabetic medication, particularly metformin causes CoQ10 deficiency. Interestingly enough, metformin also causes B12 and folate deficiency. And so, here's the thing. A lot of people with diabetes complain of neuropathy. Numbness, tingling in the feet is generally where it starts. And people with diabetic, they call it diabetic neuropathy, right? So you've heard that term before. So diabetic neuropathy is it from the diabetes or is it from the medication, particularly metformin? So the question is, does metformin cause the diabetic neuropathy, or does the sugar cause the diabetic neuropathy? Because metformin, it causes folate and B12 and CoQ10 deficiency, which all three deficiencies can cause a neuropathy. But so does high blood sugar. High blood sugar over time damages nerves, which can also lead to neuropathy. So pay attention. If you've got diabetic neuropathy and you didn't have it until after you started metformin for a number of months or years, then you may suspect that it's the metformin actually contributing to the nutritional loss that's leading to the neuropathy. But the other thing is, if you're trying to lower your cholesterol, which I think is moronic to say the best thing about it is moronic. If you're interested in learning more about lowering cholesterol and why it's a big fat myth and why you shouldn't really be focused on that, you can go and watch my series on cholesterol. I did a crash course on cholesterol, and you're more than welcome to watch that series. But statins cause CoQ10 deficiency, and again, how many diabetics are also on statins? Because these two medications are concomitantly prescribed very frequently. You go to the cardiologist and your blood sugar's high, but your cholesterol's high, so they give you both a statin and a diabetic medication. So you've got two meds now blocking CoQ10, and oftentimes there's a trifecta to this. And that is the blood pressure meds, so BP meds, also can cause CoQ10 deficiency. So now, again, your risk of heart disease, it's ironic, right? Your risk of heart disease. And so the doctors are trying to mitigate your risk. They're trying to give you drugs, rather, to mitigate your risk. So the blood pressure medication lowers your blood pressure, reduce your risk. But in the process of lowering your blood pressure, it lowers your CoQ10. Same thing with the statins. Lower your cholesterol in the name of reducing your risk, but in that very same name, they're also lowering your CoQ10, which again causes neuropathy. And then the diabetic medication, same scenario there. Now, combine all that together. These are all like drugs that are given to reduce the risk for heart disease or the development of a stroke or a heart event or a myocardial infarction, heart attack, right? So they don't just inhibit CoQ10. These medications, when you combine them in such a way, they also inhibit other nutrients. Now, I think it's also important that you understand that CoQ10 deficiency doesn't just cause neuropathy. So it can cause a neuropathy, but CoQ10 deficiency can also cause congestive heart failure. So congestive heart failure. Now, pay attention. Congestive heart failure oftentimes starts out as high blood pressure. This is one of the first and earliest warning symptoms that you might have congestive heart failure. Now, I just said that doctors give these three medications to reduce the risk of developing heart disease, right? But I also just said that by giving those three medications, we induce CoQ10 deficiency that can cause high blood pressure and congestive heart failure. So you get to make the call. You get to make the judgment call. You probably know somebody that you love. There's probably somebody in your family, somebody, maybe a friend, that is probably taking all three of these medications, and they probably have a neuropathy too. And nobody's ever even had a conversation with them about CoQ10. It's one of the most common causes of neuropathy, not because CoQ10 is so deficient in most people's diets, but it's because CoQ10 deficiency triggers neuropathy, and these drugs trigger CoQ10 deficiency. So you get to make the call. If you're on these medications, I encourage you not to just quit your medicines without talking to your doctor. Go to your doctor and have an intelligent conversation. And if your doctor's not willing to do that, then find a doctor who is willing to do that, so that you can, again, appropriately take care of yourself, right? Because if you don't do it, who will, right? You have to be your own advocate. So there's some other medications. We talked about, these three causing just specifically CoQ10 deficiency. I also said, though, that metformin causes B12 and folate deficiency. Blood pressure medications cause CoQ10 deficiency, but blood pressure medications can also cause electrolyte deficiency and electrolyte disturbances. So potassium, calcium, magnesium deficiency are very common with electrolyte use. Vitamin B1 deficiency, I said electrolyte use, but I meant diuretic use. Vitamin B1 deficiency can also be caused by blood pressure medications. And we didn't write magnesium or calcium on the board, but we could very easily do that, because magnesium and calcium deficiency also cause neuropathy. And one of the interesting things about that, since I'm talking about it, is lead blocks magnesium and calcium. So lead toxicity causing neuropathy a result of magnesium and calcium depletion or blockage? Some speculate that it is. So again, these can also contribute to neuropathy as well. I know I'm kind of sidetracking here, but I thought it was important to add that in since we were talking about it, about the diuretics. Now, also, if you're taking blood pressure, or not blood pressure, but if you're taking antacids, so Nexium, Prilosec, Tagamet, Zantac, anything that's designed to block stomach acid, know that you're actually probably causing vitamin B12 deficiency over time. And again, we talked and spent a lot of time on vitamin B12 deficiency. Also know that when you're taking antacids, you cause calcium and magnesium deficiency. You also cause copper deficiency. You can also cause vitamin B6 deficiency with antacids. So it's not something that it's not something that you want to play with. If you've got enough gastrointestinal problems that you're having reflux, the better question is why. Not what can I do to block it, but why am I having the problem? And really getting with a doctor who can help you understand and isolate the root cause reason as to why that problem exists, as opposed to medicating it. Because again, if you medicate it long enough, the outcome doesn't look pretty. And then another one is anti-seizure medications. And I know that sounds ironic, but the anti-seizure medications really block vitamin B1, block vitamin B12. I know a lot of people take seizure medications because a seizure is a type of neuropathy, right? A seizure is a type of neuropathy, but the very medication that's being used can oftentimes lead to chronic nutritional neuropathies that can mimic seizure. So, you end up chasing your tail, just like you end up chasing your tail here when you're on these medications for heart disease and you're causing CoQ10 deficiency, and you end up with more heart disease as a result of not knowing what you're doing. Same kind of thing with the seizure medications. Now, this is not me telling you to quit your seizure medications and go get in a car and start driving. This is me telling you, go have an intelligent conversation with your doctor and get these things evaluated and get these things looked at, because sometimes a person needs a medication, but if you aren't aware of the nutritional side effects of what some of these medications can do, you can actually recreate your disease in a new way, and that's not intelligent or smart either. So it's very important that you understand that. In the last category of medicines that really, I didn't write them on the board here, did I? But the last category of medicine that can create a neurological problem is your antibiotics. Antibiotics knock out your gut flora, and much of your gut flora is responsible for producing a lot of your B vitamins. So remember, a lot of your B vitamins are made in your own intestinal tract as a result of healthy gut flora, which is one of the reasons why antibiotics given, and I'm not talking about one round of antibiotics to save your life because you had 104 fever and you weren't kicking an infection. I'm talking about, every week you go to the doctor because your ear hurts a little bit and they're pumping you full of antibiotics several times a month. Like that chronic antibiotic use is what I'm referring to. Now, there are cases where acute antibiotic use can create damage to your body. So one of those examples is like ciprofloxacin, which is a very potent type of antibiotic that's known to cause tendinopathies. So particularly it can rupture the Achilles tendon, or it can damage the Achilles tendon, making it very difficult for people to walk. That can happen acutely. These long-term antibiotics causing B vitamin deficiency, that's more of a chronic thing. That's more of a repetitive use over time. So the other thing that we know on medication lists that can cause neuropathy is your chemotherapeutic agent. So if you're undergoing cancer treatment, one of the side effects of chemotherapy is neuropathy. And so these two, I'm going to put a little, well, I'm going to highlight these two here. Let's use a different color. So if you're getting chemo and you're developing a lot of neurological symptoms, know that these two B vitamins might be why, because the chemos affect your B12 and your folate. So you might benefit from higher doses of B12 and higher doses of folate. What do I mean by high doses? 10,000 micrograms a day, it's mcg. Okay, and on the folate side, upwards of 2 grams a day. And so that, for many people with chemo-induced neuropathy, is very, very helpful to kind of help them mitigate those symptoms. So if that's what you're struggling with, it's important too that if you're doing that, I recommend doing it under supervision, but if you're doing it, you want methylated versions. So the methyl forms. So for vitamin B12, that would be methylcobalamin. For folate, that would be methylfolate or 5-methyl tetrahydrofolate. 5-MTHF would be a supplemental version of methylated folate. That's going to give your body the easiest B vitamins in those forms to use to help combat what's going on with that chemo. So again, those are kind of your medicines that are that have the potential to induce neuropathy. Now I'm going to open the floor up for any questions that any of you have now that we've covered most of what I wanted to cover tonight. So tons of them coming in, more than we'll ever be able to get to. That's okay. There's always next week. Let's see here. So can you talk about high circulating B12 versus low uptake after 7 days from intermuscular shot? Is this related to mitochondrial nutritional issues? Can biologic drugs play a part? Brian, if you have low circulating B12 in the serum, but you've had intramuscular injections, it might be intramuscular injections are not the best route for you to take your vitamin B12. Try an oral lozenge. A lozenge like I have a formulation called methylcobalamin. It absorbs through your cheeks. And in most instances, I've only ever seen one person do better on intramuscular injection than on oral, sublingual B12. But that would be my next avenue. Would be if you're not pulling your B12 up as a result of those injections, it might be too that the injections are cyanocobalamin, and cyanocobalamin is not all that bioactive and not all that helpful. Can be problematic for conversion. So that's what I would look into. May wants to know, can damage from B6 toxicity be reversed? Yes, it can, and that's the great thing about pretty much most of these things. In most of these instances, the damage is really reversible. Now, where you run into trouble, nerves are slower to heal, and so it can take a little bit of time. But it depends on how long you've been taking that B6. If you've been taking that B6 only a few months, the damage should go away really quickly. After you cease the B6 intake. I mean, we're talking about a few days. We're not talking about a few years or a few months with vitamin B6. But if you've been taking it chronically for 10 plus years and you've created a lot of nerve damage, it's going to take a little bit longer. So a lot of that just depends on how long you've been, whatever it is, that whether it was B6 toxicity or something else, whether, how long that was going on. What can be causing severe foot cramps that radiate in the head, mainly when lying down? Can this be a neuropathy too? It sounds more like an electrolyte disturbance, which can be a neuropathy. So calcium and magnesium, depending on when the foot cramps are happening. If they're happening at night, then there's a strong likelihood you have a calcium deficiency. If they're happening in the morning or during the day, there's a strong possibility that your potassium or your magnesium might be low. But those are the two things I would look at first in terms of the main minerals. Now, dehydration can also do that. And some people that overconsume caffeine. So if you're doing 5-hour energy, you're doing a lot of coffee, 2, 3, 4 cups a day, even tea. If you're a heavy tea drinker and having several cups a day, you can get too much caffeine, and that can cause that type of foot cramping as well. Let's see here. Burning tongue. Yes, Colette. I love that question. So burning tongue neuropathy, number of different reasons, but probably one of the most common is heavy metal toxicity. Mercury toxicity is very common with burning tongue syndrome. Additionally, though, I've seen cases where mold toxicity was the progenesis of a burning tongue. So a person stuck in an environment where they were being exposed to high levels of toxic mold or mycotoxins as creating that burning tongue scenario. Now, those are probably two of the more common for burning tongue. Now, B12 deficiency can cause a burning tongue. B2 and B3 deficiency can cause a burning tongue as well. So I'd look for all of those things to rule it out. Let's see here. Yeah, so somebody's chiming in. Ruth says, didn't get my notice for the show tonight. Look, we're being suppressed. Our information's being suppressed. The powers that be don't want you to have this information. So if you really want to make sure you're getting this information consistently, the best way that I can tell you to make sure that you get a notification is to go to our YouTube channel. That's youtube.com/glutenology. And once you're there, so if you just youtube.com/glutenology, hit the subscribe button. And once you hit that subscribe button, there's a little bell that you'll see. Hit that bell. That bell means that you want YouTube to email you notifications when we go live. And so that's the best way to ensure that you're not getting the email, because we send emails out every time before the show. And if you're not getting it in time, it's probably because your inbox is being suppressed, or my email is not ending up in your inbox. It's ending up in your spam or your promotions box. Okay, can you get neuropathy from being on benzoklonopin for 25 years? Not, and I'm not saying you can't, but to my knowledge, I can't answer that intelligently, because I don't think so. I mean, the benzos, can they cause neuropathy? Not to my knowledge. It doesn't mean it can't happen. That's an awful long time to be on it. I'd say it depends on the dose, and I really would say if you've been on it that long, most people that are on the benzodiazepines like that, it's for sleep, and generally they have a hell of a problem in their B vitamins, and that's one of the reasons why they're struggling with the sleep issues. So that would be, it may not be the drug that's causing it. It may be the unresolved problem that you were prescribed the medication to take for in the first place. Let's see. I had a disc bulge so tiny, not more than a few centimeters, in pain in my arm. It was work-related, but through tons of chiro, was able to fix it. During the injury, it hurt, and I would take naproxen. So yeah, so that's common. That's good, Deandra. I'm glad you mentioned that, because some of you with the disc bulge, like, what's the best care for that? Like, chiropractic is great treatment for that. Decompression or spinal decompression or spinal traction is a good therapy for that. Some people find that lasers, cold lasers, are very helpful as well. And of course, physical therapy, exercises, McKenzie exercises, cervical strengthening exercises, all important in overcoming those physical neuropathies where there's a disc herniation or something physical. Let's see here. Tuning in from Michigan, going to learn from my husband, who wakes with foot pain 4 to 5 times every night and has to stand up to relieve it. That sounds like a foot pain of a cramp, Cindy. So I would really, get your husband and his doctor to check his electrolyte levels, and not serum electrolyte either. Again, check that intracellular nutritional status. Let's see here. Yeah, I see that a lot. Like, pain management docs, Toby, will say, yeah, you shouldn't have the numbness and tingling when you explain it to them. Like, they'll a lot of times the pain management, I erased it, but the pain management docs, a lot of times, and it's not your fault, but a lot of people shop for pain medicine. So like, we used to have people come into our clinic all the time wanting to get morphine-based drugs, wanting to get things like oxycodone. They were doctor shopping, and they were addicted to the medication. And that's the problem with opiates, is that you may have the best intentions when you first start taking them, because they're so addictive, though, and you get addicted to them, you'll do things that you wouldn't do, because you're not in your own mind. You're not in control of your own mind. But a lot of doctors are really skeptic about pain patients because of that. So they're actually special orthopedic tests that we run on people to ensure that they're not lying to us. They're like trick tests. So at any rate, yeah, it's not an uncommon thing for a doctor to be skeptic about whether or not you're having your symptoms. Is there, let's see, Dora says, I have high B12 but numbness and tingling. Is there a connection here? Doctors here do not seem concerned that my B12 is high. If it's serum B12, again, there's no toxicity level known with high levels of serum B12. Even if it's over a couple of thousand, it's probably not got a connection with your numbness and tingling. There's something that's being missed, Dora. And I go back and start with this. Start with having those things looked at. Let's see here. Wow, can plantar fasciitis lead to neuropathy in the long run? RH522 wants to know, can plantar fasciitis lead to neuropathy? It possibly could, but it's not really something that we would say, oh, the plantar fasciitis caused the neuropathy. Plantar fasciitis is an inflammatory process that goes on in the soft tissue underneath the foot and in the Achilles tendon, and generally it's plantar fasciitis is usually, in my experience, grain induced. So if you've got chronic plantar fasciitis and you're not on a grain-free diet, that's where I recommend that you start. Go read No Grain, No Pain, because that I've seen that resolve people's plantar fasciitis time and time again. Just the diet change. It's typically not causing the neuropathy, although if the foot gets swollen enough and retains enough fluid, you can get neurological compression syndromes in the foot compartment that can lead to numbness and tingling. But that's, again, it's more of a secondary cause of neuropathy than a primary. Let's see. Depression. Okay, Roxy wants to know, what about depression? So what about depression? Depression can be a form, we can call it a form of neuropathy. It's more of, a central neuropathy if we're talking about neurological depression of thought or feelings, sadness and that kind of thing. Very common for B vitamin deficiency to cause that type of neuropathy. So I would, if we're being simple about it, look into those as kind of a hallmark to what might be creating it. How do you check for metal toxicity from ankle and hip replacements? First, that's what Dee Dee wants to know. First, Dee Dee, if you've got a hip replacement and an ankle replacement, and you've got metal in your body, get what's called an MDS. MDS stands for Materials Data Sheet. So this, whatever they put in your body, there is a very extensive MDS on that implant, and you can read what are the metals within that implant, or what are the materials that were used to make that implant. And then from there, what you would want to do is you'd want to get tested for what's called a delayed hypersensitivity reaction, and that's a specialized type of test that can be tested against metals, so you can determine whether or not your immune system has started to view your own implant as an enemy. I've seen this happen in a handful of cases over the past 20 years. I had one woman that was reacting to a screw that was implanted in her foot, and I had another gentleman who was reacting to the mesh. It was a hernia mesh that he had surgically put in for a hernia, and he was dying from it. His body was having such a severe immunological reaction to the mesh that he was close. He was on death's doorstep before we figured it out, and he's now he's doing great. But yes, you can get hypersensitivity testing to the different materials that your device is made from. And my advice to anybody getting ready to go through surgery would be to test for that stuff before you have the implant put in. If you really truly need the implant and need to have the surgeon put it in, then test for metal toxicities and test for the sensitivities before you do the implant. And that way you could, there are options. You might have one implant made from, certain materials that you're reactive to, and another implant that you're not. And so that might be a better option for you as a unique person to go with. I don't know why surgeons don't do this as a standard of care. To me, it always made sense that if you're going to put a foreign object into a person's body, because we know about it, there are textbooks written on the topic of foreign objects, creating an autoimmune process in the body when the body is overreactive. And so we know this. Why doctors don't test for it as a standard of care, again, that's beyond me. Let's see. Kay Schultz, she's got a neuropathy that includes sensations of insects biting, fire ants crawling, and electrical shocks. Doctors at a loss. Could this be related to iron deficiency or Hashimoto's? It can be, but again, look, if you really want to rule out a neuropathy and its cause or its origin, you've got to do really some fundamental things. Number one, you've got to rule out physical causes. So physical causes would be, again, what I talked about earlier tonight. Number two, you got to rule out chemical causes, whether that's chemical toxicities or whether that's nutritional deficiencies. Those things are the hallmarks of where you're going to find the majority of your answers when it comes to mysterious neuropathies. I've seen it play out 1,000 times in the last 20 years where people had chronic neuropathy of unknown origin come to me, and we find out it's something simple. So, I mean, I say simple, relatively simple. It's not super complicated, although it was super complicated for so many other specialists before them. And it's not that it's that complicated. It's just that most doctors don't value nutrition enough to even look at it. They just don't appreciate it because they don't have an understanding of it. And that's, one of the fundamental problems of medicine today is that 7 hours or less of nutritional classwork gets instructed on in medical school. And so if a doctor really wants to get nutritional specialization, they have to go outside. Once they graduate, they got to go to postgraduate courses for years before they can get the knowledge and even be kind of at a level where they can say, I have some knowledge. I mean, I'm not talking about mastery. I'm talking about basic information and basic knowledge. And to give you an example, I went to postgraduate classes on nutrition for 3 years. And that was after having a very heavy nutritional curriculum, which is why I kind of have an advantage over a lot of other doctors. I mean, I'm one of, maybe 350 doctors in the world that is board certified as a, DACBN stands for Diplomate with the American Clinical Board of Nutrition. So we are the doctors that have a greater degree of nutritional training as a minimum criteria to be able to practice in this way. And there's just very few of us. There's just not a lot of us that are out there. Let's see, Dwayne, I'm on hydrocortisone tablets and Synthroid. I had a pituitary tumor removed and it left me taking those 2 drugs. Well, yeah, I mean, if you're on those medicines, Dwayne, as a result of having, a tumor removed, that's a little bit different, right? You took the tumor out, probably it was going to save your life. So, without knowing more of your backdrop or history, but, ask the doctors that are prescribing that hydrocortisone and Synthroid. First of all, you should know that Synthroid, if you're trying to be grain-free on the no grain, no pain diet, Synthroid's got corn in it. So ask your doctors about compounding Synthroid without the corn. The other thing is with hydrocortisone, you need to understand that drug itself is going to, over time, it's going to cause bone loss. It's going to cause muscle loss. So you have to be ever more aggressive about how you exercise. You have to be ever more aggressive about monitoring your nutritional status. We didn't even talk about vitamin D tonight. That's one of the side effects of corticosteroid is they cause vitamin D deficiency. And vitamin D deficiency can also cause neuropathy. We didn't talk about it tonight, but it is one of the nutrient deficiencies that can cause neuropathy as well. Susan says, or question mark, trigeminal neuralgia. So what about it? Trigeminal neuralgia is a form of neuropathy. I've seen a number of cases of trigeminal neuralgia respond really well to a gluten-free diet. And when I say gluten-free, I mean wheat, barley, and rye, but not just wheat, barley, and rye. You've also got to cut out the corn and the rice and the sorghum and the millet and the amaranth, buckwheat, and quinoa, the pseudo grains, the pseudo cereals. If you haven't done that already, then do that first as a simple dietary intervention to see if it helps improve how you're feeling. Yes, I've heard it. Lisa wants to know if I've heard of St. John's wort causing tingling all over the body. Yeah, St. John's wort, especially if you're on an SSRI, those two should not be given together. So like some people that are taking drugs for depression also take St. John's wort naturally. And those two things don't play very well, and they can create and contribute to neuropathy and different types of problems. So if you're on that St. John's wort and experiencing that, my advice would be stop it. And if all those symptoms go away, then you have kind of a direct answer to it. Does a conventional doctor take the necessary tests for vitamin deficiencies? In my experience, Carmela, no. Conventional doctors, even if you ask them to run the tests, a lot of times they don't know what they're doing. So they look the test up in a book from the lab, and then they'll order tests, but they don't understand the methodologies or they don't understand the accuracies of the different types of nutritional testing very well. So what they order may not be super accurate. And that, again, that's not saying all doctors, but traditionally, in my experience, and I've been in practice about 20 years now, I've not yet seen a person come to my clinic where it was common that their traditional doctor measured the right methodology of testing to really ascertain somebody's nutritional status. Okay. Oxytocin for 12 years. Took myself off 4 years ago. Can my body heal from the damage? I modified keto, just developed AFib during surgery. Jamie, I mean, that's a bigger question than what I really could probably guide you on in this type of medium, because you really should have a full gamut of a workup done to really try to ascertain, what else might be going on that's contributing to what you're having. So, Two Girls in a Pressure Cooker. I like that name. I have chemo-induced. Can it get better with long-term B12 and folate? It may get better. Yeah, I mean, even in the short term, I've seen cases of chemo-induced neuropathy where improvements were actually quite quick. So it depends on the person. But yeah, I have seen it get better, and I've also not seen it get better, but it's real inexpensive and very safe to try. Alpha-lipoic acid. Gerardo wants to know on alpha-lipoic acid to regrow nerves damaged by different neuropathies. Yes, alpha-lipoic acid, and we really didn't talk about that tonight, but alpha-lipoic acid is a very, very potent antioxidant, and it's very, very potent at helping regenerate damaged nerves. I have a formulation called Alpha Max, and that's used in this type of scenario for people that really, really struggle, and we're trying to really help support their ability to regenerate new nerve tissue. So great. I'm glad you brought that up because I meant to bring it up tonight. It just got lost in the mix. Thanks, Gerardo. Can using a foam roller take pressure off the nerves, and is it safe to use a foam roller in the same area every day? Yes, it's safe to use a foam roller. Can it take pressure off of the nerves? The foam roller is more going to break up any type of adhesions that you might have that are kind of adhesing and like restricting the movement of the nerves. Probably not physically going to take the pressure off the nerve. It's just going to make the tissue around the nerve more fluidic so that that nerve is not being restricted in its movement. Let's see. What about benfotiamine? Well, I did a whole show on B1, Dwayne. If you want to go back and watch that, I talked about benfotiamine as one of the best forms of vitamin B1. Definitely something that can help with neuropathy. Jamie wants to know about mold and mycotoxins. And those, I'll answer this question shortly. Those mold and mycotoxin exposure can be one of the things that causes neuropathy. And I've done a few shows on that, Jamie. If you go back in my archives, you'll find part 1 through 4 on mold toxicity and how to remediate and how to get it under control, both mold and mycotoxins. Okay, Michelle, what about methylcobalamin plus 50 micrograms of B12? Any benefits to this combination? The question doesn't make sense, Michelle. Methylcobalamin plus 50 micrograms of B12. Are you talking about cyanocobalamin, adenosocobalamin? Are you talking about hydroxycobalamin? Because there's 4 major forms of cobalamin. And so methylcobalamin is a great form. 1,000 micrograms might not be enough to correct the neuropathy. It's a low therapeutic dose. It doesn't, 5,000 micrograms is generally where I start people. But as far as the other B12, I'm not sure. I didn't get any clarity from you on what you meant by which other form. Can neuropathy in the brain be reversed? Denise wants to know. Was B12 deficient for years? I'm confused because one test shows I'm deficient, another test shows my B12 is over the normal range. It's because you've had a serum test done. Serum tests, again, they're really not worth the paper they're printed on as it relates to B12. They're just not super accurate at helping you understand your B12 status. So without knowing what your other result was, it's hard for me to comment on the validity of the other test. If any of you though that are doing hair testing to try to isolate vitamin deficiencies, don't waste your time. There's a new company that's out there right now doing hair testing, and I just don't recommend hair testing if you're trying to nutritionally assess somebody accurately. Well, I like this one. Leslie wants to know about erythromelalgia. There's only like 13 or 14 cases in the world, Leslie, and at least to my last knowledge. And I actually I'll say the honor and the privilege of treating somebody with this particular condition. And it's an autoimmune condition that affects the valves in the veins. And so what happens is when a person starts to walk, because those valves don't close in their veins, the blood pulls in their feet, so they can only go so far before their feet burn tremendously and they have to stop and prop their feet up. And so this is an autoimmune condition. In the one case that I've seen, and again, by no means am I an expert in erythromelalgia, but in the one case I've seen, we took a woman from walking about 100 feet before she had to stop to walking several blocks where she could keep going. And so And that was through, and the way we were able to do that was one of the things we found out about her was she actually was gluten sensitive. And so, again, autoimmune disease, most forms of autoimmunity, in my experience anyway, have some progenesis behind gluten, meaning gluten is one of the big reasons as to why many of these people develop autoimmune disease. So that might be helpful for you. Okay, can damage from B6 toxic? I think I answered that one. Let's go down on that feed a little bit more. What about sciatica pain that goes down the leg to the calf and will not go away when standing up from a sitting position? What deficiency? So Maxine, depends. The sciatica, by default, if you've got sciatic nerve pain, it could very well be because of a structural issue. A lot of people have a muscle in their pelvis called, it's not a lot of people, everybody has this muscle, period. It's called a piriformis muscle, but it can get really tight and spasm, and it can put pressure on that sciatic nerve, whether you're seated or whether you're standing, and it can cause that neurological type of pain. You can also have a herniated disc that's compressing into the sciatic nerve as it exits the spinal cord, and creates that type of radicular pain pattern as well. So best thing, if you've got a sciatica, the first thing that you should do is don't suspect this so much as you suspect a physical problem. And my advice would be get with a good chiropractor. They're really, really in tune with diagnosing sciatica accurately and getting you the right kind of therapies to help you. A lot of people, kind of maliciously attack chiropractic, I think unfairly. Chiropractors are some of the smartest practitioners in the world. They virtually have the same training as medical doctors, minus the hospital rotations. They virtually have the same training and background. So smart folks. Some of the smartest people I know are chiropractors. Let's see here. How does gluten cause autoimmune disease? Asks Jeffrey. No, I don't mean glyphosate either, Jeffrey. So that was, I guess, part 2. So glyphosate is the poison that's being sprayed on our food, right? And it's a industrial chelating agent that used to be an industrial chelating agent, meaning it was used to scour metals and descale things. And then it was discovered that nothing would grow, and so then they turned it into a pesticide, herbicide. And so now they spray it on a lot of our plants and a lot of our food, and it definitely is a poison. It's a known carcinogen, and there's really great suspicion that it contributes and triggers autoimmune disease. But gluten in and of itself also triggers autoimmune disease through a number of different processes. Many people with gluten sensitivity, and not everybody's gluten sensitive, but the ones that are gluten sensitive, when they get exposure to gluten, they have an immunological reaction to that gluten that sets the stage for damage of their own tissue. And so celiac disease is the prime example of that, where gluten exposure can lead to an immune system that goes rogue, that begins attacking the villi in the small intestine, leading to damage of the small intestine, inflammation in the small intestine, and subsequent malnutrition, which can then lead to a host of other problems. So gluten causes autoimmune disease all by itself. Glyphosate, there's no research that says directly that we can say we know for certain, without beyond the shadow of a doubt, that glyphosate causes autoimmune disease, at least not that I've seen published. But there's a lot of clinical anecdote, and there's a lot of clinical suspicion that glyphosate is linked to a number of problems that the modern world and the modern food supply are facing today. So great question. Okay, Michelle says, became vegetarian, no dairy, no gluten, no sugar, some fish to combat cancer, have Hashimoto's, have neuropathy in feet and hands. Should I supplement with more B12? It's a good question, Michelle, but what you really should do is have your nutritional levels checked so that you know whether or not that's the right thing. If you became a vegetarian, it's not to say that vegetarians can't get B12 from their diet, especially if you're eating fish, but you're definitely going to put yourself at a greater risk for the development of a vitamin B12 deficiency if you're following the traditional vegetarian-based diet. Okay, what is the best test for B vitamin deficiencies? Again, I'll say it again, lymphocyte proliferation. So it's where the doctor draws your blood and they draw out the type of blood cell called a lymphocyte. These are your immune cells. The lymphocyte's a great medium. Why do we use it to test for deficiencies over, let's say, other cells? It's because it has a 6-month life cycle. So it can give us an average of your nutritional status over a period of about 6 months. So it gives us this nice long window about what you've been eating and how effective that's been at getting into your cells. It's the other reason why we use intracellular versus serum, because intracellular, remember, your vitamins don't work in the serum. They work inside the cell. That's where all the activity happens. So we want to know whether the vitamin is getting from the serum into the cell. And if you stop short in the serum, you could have all this B12 in your serum, but if it's not penetrating into the cell, you're still out of luck and you're still going to have a deficiency. So intracellular analysis. Nancy wants to know, can you eat organic oats on a gluten-free diet? I'm still waiting for your book. Well, when you get my book, you'll learn that no, you can't eat organic oats. That oats contain a type of gluten called avenin, and there are a number of research studies that show that people with gluten issues react to avenin as well. So if you're really trying to dial it in, you don't eat oats. Can alpha lipoic acid and carnitine supplements cause neuropathy? I've never seen that happen. Gregorio, I don't know if I pronounced your name right, but I've never seen that happen. I don't ever like to say no, something can never cause something else, because I've just been in practice long and there's too much biochemical individuality in one person to another. I've seen some people react to a vitamin or to a mineral, that was very, very unique to their own situation and circumstance. And I'd never seen that clinically before. And we tested it by removing it and re-adding it in. So I would not say that it couldn't cause it. I would just say that I've never seen it clinically cause it in somebody. And I used a lot of lipoic acid and carnitine. Okay, let's see here. I think we're pretty much out of time. So follow up on that sciatica question, then we got to wrap it up. Piriformis muscle not working. Stretching piriformis muscle is not working. Is there anything else that can help with a sciatic? Yeah, get an x-ray, get an MRI, and make sure you don't have a herniated disc that's creating that sciatica symptom. Have your sacroiliac joints adjusted. Sometimes having your SI joint adjusted can be effective. If your chiropractor is already doing that, great. And sometimes one of the other things that has to happen with the piriformis muscle is there's scar tissue or adhesion that's in it that's super deep. So just general stretching won't work. And so what really has to happen is somebody's got to get in there and do what's called myofascial release or manual therapy. There are a couple of techniques. One of them is called Graston technique. Can be very, very effective at loosening up any kind of fibrotic tissue that might be adhesing and creating that sciatica nerve pressure. So those are all other options for you, Barb, that might be very helpful. So, all right, folks, we got to wrap it up. It was great being here with you Monday night. Hey, if this is your first show, if you're new to Pick Dr. Osborne's Brain, just make sure you mark it on your calendar. Every Monday at 6 p.m. Central Standard Time, we're here for you to help you. Our goal and our mission is to help save 100 million lives. So as always, I'd appreciate it if you would hashtag me tonight so that people can find us. And the hashtag is save 100 million lives, no spaces. Remember, we're trying to reach the people that can't get this information, that don't have this information, that have doctors that refuse to talk to them about this information. We're trying to enlighten the world, get people educated. So if you're new, make sure you're subscribing and make sure you come visit me at glutenfreesociety.org, where you can learn more about how the gluten-free diet can help reverse autoimmune disease and chronic pain. And if you come over there, you can sign up for our newsletter and we'll send you for free a free gluten-free survival guide to get you started on the diet. And as always, thank you for your listenership. Thank you for tuning in. It's a joy for me and a privilege for me to be able to spend my Monday evenings with you, helping you. So we'll see you next Monday. Wishing you excellent health. This is Dr. Osborne saying good night. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.